Hello, I'm Haritha Veeramachaneni. I'm a plastic surgeon at Long Island Plastic Surgical Group, and I'm here today to talk to you about virtual consultations with your plastic surgeon. This has been a very important topic for us and for our patients alike during the COVID-19 pandemic. Today we'd like to talk about just the ease of making a virtual appointment with us and what are the things that your plastic surgeon can diagnose or treat or recommend through a virtual platform. As you all know, the pandemic started as early as February and March in the United States in 2020, and look, we're still here in September dealing with its current and after effects. It's so important to maintain your visits and relationships with all your physicians so that anything important medically is not neglected. All specialties have capabilities now of making virtual appointments, and plastic surgeons are no exception. So whether you have elective concerns or medically urgent or even emergent concerns, we can certainly address them through a virtual platform. So what patients can expect for the virtual appointment? First is the ease of scheduling them. Due to the pandemic, we all find ourselves on different work hours, and so our appointments are designed to accommodate those hours throughout the day and even on Saturdays as well. Our secretaries and staff in the office will help you get started. So whether you have a Samsung or an iPhone or desktop or laptop, the technology is very simple. It requires a very easy download. We use a platform called Microsoft Teams, which we're very proud of and happy to offer, as it's a HIPAA compliant and secure platform where you can be assured that during the consultation your information is kept private and secure. Many of us at Long Island Plastic Surgical Group are specialists in breast reconstruction, as am I, and during the pandemic, that was one of the surgeries which we still actively performed, as it's an urgent issue. So many of these consultations took place and are currently taking place virtually. This platform does allow us to both take a history as well as get a very reasonable physical exam. So the visit will start off very similar to how it is in real time at your doctor's office. You're going to have to fill out a medical history form, which your doctor will review. You will interact virtually or over the phone with our nursing staff, who may ask you additional questions for clarification. We may take information down about your medications, your allergies, your pharmacy. Any of that is still applicable, and the doctor, of course, will review all that information. Then we go through a process where we actually just talk first, and we get information about your diagnosis, your history, the prior surgeries you've had, any other medical history that you would like to share. So the visit is pretty much the same as it would happen in person. Now, for the physical exam, that of course is different, as we can't actually see you in person or touch you, but as long as you're in a room with good lighting and a good camera, we are able to get a very thorough physical exam. We will ask you to undress and examine the areas of your body that we would need to see. And while we can't touch you, we might ask you to place your hands on certain parts of your body, which will help us examine the nature of the tissue in that region and give us more visual information to the area. And then afterwards, we will have a lengthy conversation about what your surgical treatment options are. And one thing I found in virtual consults is kind of the intimacy of this process, as well as the increased time that we're able to spend talking to each other. One of doctors' biggest complaints, and I think patients' biggest complaints, is how rushed their doctor is. And this is often true in the office, where we have many patients scheduled and cancellations and appointments may not be running on time. Whereas I find with the virtual platform, everyone has a little bit more ease and flexibility, so that when we're talking to you, it just doesn't seem as rushed, because there's not a patient in the room next door waiting to be seen, and we can really just focus our undivided attention on you and take as long as we need to. During our breast reconstruction consults, is we typically review some of the implants and devices that we use during surgery for breast reconstruction. So one of the most common methods of breast reconstruction, of course, is a tissue expander. So through a virtual platform, we are able to show you how it works, approximately how big it is. We're able to show you drains and tubes which are used during the surgery. And we're also able to show you examples of typical implants that are used in breast reconstruction after the surgery. So we go over all those. And another aspect of the virtual platform is the doctor has control over which device they are conducting the consult from. It can be from their desktop, their laptop, even their phone, and wherever their patient education folders are shared, those can all be now shared with you. So some of my patient education folders, especially for breast reconstruction, include photos of patients, before and after photos of women undergoing breast reconstruction, or a picture of a patient's breast in the office getting expanded with saline. So all of those pictures can be shared in real time, and those can be discussed with the patient during the virtual consult. We can discuss mastectomy incisions that might be appropriate for a particular patient, how long it takes perhaps to get expanded to the desired size that they would like to have. All those can be shared with real before and after photos in real time with the patient during the consult. Doctors and patients alike have found this very convenient to conduct their appointments. Everyone has different comfort levels of going out into public, and depending on their own medical history, they may not be candidates for public transportation or lengthy rides, or being around other people, or they just take social distancing very seriously. So we're always happy to accommodate any of our patients through these virtual platforms. Some tips I have before the appointment that you have with your doctor, especially for a plastic surgical issue, is just to make sure you're in a well-lit and private area of your household. It should be a space where you feel comfortable getting undressed and getting dressed again. And if you could minimize background noise or interruptions from family members, that would definitely be helpful in conducting making sure the consult goes smoothly.